11 Early key signs and symptoms of lupus. Did you know that at least 5 million people worldwide have some form of lupus? Lupus is a type of autoimmune disease. This means it causes your body's immune system to attack healthy tissues and organs, instead of only attacking foreign substances that could harm your body. The disease can cause widespread damage to areas of the body, including the joints, skin, heart, blood vessels, brain, kidneys, bones, and lungs. Symptoms of lupus typically start in early adulthood between ages 15 and 44. However, early signs and symptoms may be hard to detect because they're similar to those of other conditions. In this video, we will break down 11 early signs and symptoms of lupus so you can recognize them and seek help early. Let's start with the first sign: unexplained fever. A very early sign of lupus is the development of a low-grade fever for no apparent reason. Typically, this fever sits between 98.5 and 101 degrees Fahrenheit, or 36.9 and 38.3 degrees Celsius. Most people don't see a doctor when this happens, since by itself it's not often a cause for alarm. Yet many individuals with lupus might have this type of fever on and off. This should be an alarm bell that you need to get checked out, because a low-grade fever could be a symptom of inflammation, infection, or imminent flare-up. If you have recurrent low-grade fevers, get checked out by your doctor to determine the cause. As we move further through the warning signs, you'll notice that many symptoms of lupus are not experienced by every person who has the disease. Each person diagnosed will have a unique set of symptoms, which vary in severity. However, this list outlines the most common early signs of lupus, so that you can be armed with the top possible warning signs to look out for. Now the next warning sign is hair loss. Inflammation caused by lupus can also impact the skin on your scalp, leading to hair loss. Hair loss, such as thinning hair and bald spots on the scalp, are usually one of the first signs of lupus. This may eventually lead to more extreme hair loss. Some sufferers notice their hair comes out in clumps, but most of the time hair typically thins out more slowly. As well as the scalp, individuals may experience a thinning of their eyelashes, eyebrows, and other body hair. Lupus treatment usually results in renewed hair growth, but if you develop lesions on your scalp, hair loss in those areas can be permanent. Now, I think it goes without saying that any unexplained hair loss is a cause for concern, and especially when it's in combination with any other signs on this list, it could be a symptom of lupus. The third, as well as the main symptom of lupus, is number 3, skin lesions or skin rash. One of the most visible symptoms of lupus is a butterfly-shaped facial rash that appears over the bridge of the nose and on both cheeks. It affects 1 in 2 people with lupus. This symptom may occur suddenly or appear after exposure to sunlight. Like other signs and symptoms, this rash might come and go. And on top of this common lupus rash, you can also experience skin lesions on different parts of your body. These commonly appear on skin that has been exposed to the sun, such as the face, neck, ears, legs, and arms, because individuals with lupus tend to be more sensitive to the sun. These skin lesions are usually thick, scaly, raised patches that are pink and white in color. You may also experience discoloration in the fingers and toes. Being one of the most obvious signs of lupus, be sure to book an appointment with your doctor immediately if you notice any of these skin problems occurring. This brings us to sign number 4. Photosensitivity. Photosensitivity is among the most common and main symptoms of lupus. Up to 70% of people with lupus will experience photosensitivity, or sensitivity to sunlight or ultraviolet (UV) light. If you have lupus, sun exposure can trigger symptoms such as skin rashes, itching, burning, joint pain, weakness, and fatigue. In some cases, it can even cause organ damage. Again, if you experience these symptoms when exposed to the sun, especially accompanied by other symptoms of lupus, speak to your doctor as soon as possible. Sign number 5. Kidney inflammation. Lupus can cause inflammation throughout the body. Up to 50% of adults with lupus will develop kidney inflammation, called nephritis. Inflammation makes it harder for your kidneys to filter toxins and waste from the blood. As a result, these toxins can build up in the body, leading to further health issues. Lupus nephritis typically affects people ages 20 to 40 and starts within 5 years of initial lupus symptoms. However, it affects children as well and is often severe. Symptoms of nephritis include swelling in the lower legs and feet, high blood pressure, blood in your urine, dark or foamy urine, having to urinate more frequently at night, puffiness, and pain in your side. It's important to not ignore any of these symptoms and have your kidneys monitored after diagnosis. Untreated lupus nephritis can lead to end-stage renal disease, and dialysis or a kidney transplant might be needed. Sign number 6. Swollen and painful joints. Usually when you think of swollen, stiff, or painful joints, you might think of arthritis. Interestingly, these symptoms are also caused by lupus. With lupus, inflammation within the body causes pain, stiffness, and visible swelling in your joints, particularly in the morning. It may be mild at first and gradually become more obvious. And like all lupus symptoms, they can also come and go. Along with swollen and painful joints, you may also experience muscle aches. If this is something you're frequently experiencing, it's important to see your doctor and determine what is going on. And be sure to tell them about any other symptoms you have been noticing, no matter how unrelated they may seem. Number 7. Lung and breathing issues. Inflammation of the respiratory tract is also an early sign of the disease. The most common symptom is shortness of breath and severe, sharp chest pain when you breathe, laugh, cough, and sneeze. In people with lupus, the lungs themselves might become inflamed, along with the blood vessels of the lungs. Shockingly, as time goes on, inflammation caused by lupus can actually decrease your lung size. This condition is often referred to as shrinking lung syndrome. Usually, your doctor can diagnose this from a CT scan, along with gathering information about your symptoms. Number 8. Fatigue. Up to 80% of people with lupus experience some level of fatigue. You might notice you've started taking an afternoon nap, even though your sleeping patterns haven't changed, or you just find you're suddenly exhausted all the time without any reason. Although abnormal fatigue can be a result of so many different causes, if this is a symptom you're experiencing, especially when paired with any of the other signs, it's a good idea to book a visit with your doctor. It's always better to be safe than sorry. Number 9. Digestive problems. For lupus sufferers, inflammation is common along the gastrointestinal tract. This inflammation can lead to problems such as acid reflux, heartburn, nausea, gas, vomiting, stomach pain, dark bowel movements, bloating, and reduced appetite. While mild forms of these symptoms may be improved simply by making diet adjustments, if you experience frequent digestive discomfort or episodes increase in severity, you'll want to book a visit to your doctor so that they can rule out lupus or other conditions. Remember to mention all other symptoms you have. Number 10. Dry mouth and dry eyes. A dry mouth doesn't always just indicate that you're thirsty or dehydrated. Combined with gritty, dry eyes, it could be an early sign of lupus. This is because people with lupus can develop another immune disorder called Sjogren disease. This condition causes the glands responsible for tears and saliva to malfunction, and lymphocytes can accumulate in the glands. In fact, it might not just affect your mouth and eyes. Sjogren disease can also cause genital dryness and dry skin in women. This condition usually affects up to 20% of individuals living with lupus, so it's definitely something to be aware of. Now the last warning sign on the list is number 11, thyroid issues. The thyroid is a vital gland in the body responsible for producing hormones that play a role in metabolism, growth, and development. When the thyroid isn't functioning as it should, you might experience weight gain or weight loss. You might have mood swings, fatigue, dry or brittle hair, and problems related to your brain, kidneys, heart, or liver. Did you know that people with lupus are at a higher risk of developing thyroid disease? You may have been diagnosed with hypothyroidism, which is when your thyroid is underactive. Or you may have been diagnosed with hypothyroidism, which is when your thyroid is overactive. Usually, your doctor will diagnose any thyroid problems via blood tests. If you suspect you might have a thyroid issue, such as you've been gaining weight for no real reason and feel constantly exhausted, it's a good idea to get checked out by your doctor, whether it's a sign of lupus or not. It's something you definitely want to find solutions for. There you have it, the top 11 early warning signs of lupus. Just remember, though these are the most common signs, they aren't the only signs. Other, less common signs of lupus may include mouth ulcers, swollen lymph nodes, muscle pain, osteoporosis, depression, dizziness, and anemia. This brings us to the end of the video. I do hope you learned something new, and if you did, please remember to like the video and leave us a comment if you want to share any of your own experiences, which might help other people. And don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Thanks for watching, and until next time.